Hello, and thank you for your interest in our bariatric program. My name is Janet Schreier, and I'm the coordinator for Altru's Bariatric Center. My job is to help you through the program and work with your insurance company for authorization. Altru's Bariatric Center is committed to providing you with all of the resources that you need for successful weight loss. In this video, you will hear from members of our team who will help you with your weight loss journey. You can also hear from some of our patients about their experiences with the program. Generally, you can consider surgery if you have a BMI above 40, a BMI of 35 to 40 with related medical conditions such as high blood pressure, hypertension, diabetes, coronary artery disease, or sleep apnea. And you also must have previous weight loss attempts that did not result in long-term weight loss. First, we will hear from Susan Streitz, one of Altru's dietitians. She will explain the dietitian's role in your weight loss journey.
My name is Sue Streitz. I'm one of the dietitians here at the main clinic. There are also several dietitians that work in the satellite areas that you could be working with as well. Whenever working toward weight loss and permanent weight maintenance, nutrition is a very important part of that. We realize that those changes are difficult, but we will help you get through that. Weight loss is encouraged or actually required before surgery. The reason for that is it makes surgery go better. It helps with recovery, and it also proves that you are already making the lifestyle changes that are needed to keep the weight off. New Start is a lifestyle change program that promotes healthy weight loss after surgery. It's 6 weeks long. Most people take it after surgery because it's more timely then. Before going into New Start class, and actually before having surgery, you will meet with a registered dietitian individually. During that time, we determine what areas you need to work on and come up with strategies on how to deal with it. You'll also receive a meal plan that usually consists of 3 meals, maybe 3 snacks to go along with it. We'll also go over tools for weight reduction based on the changes that you need to make. The visits with the dietitian, unfortunately, are often not paid for by insurance, so that you are aware and prepared for that. We offer New Start classes in Grand Forks and also in Devil's Lake and Roseau. We meet once a week for 90 minutes. Examples of topics that we cover in this class include meal planning, portion control, healthy snacking, goal setting. We also talk about the importance of proper texture in the foods you eat, eating the protein first, among other things. It's also a great time for camaraderie and sharing with each other what is going well. With everything, everyone can help each other, and it's a good group time. Foods to avoid post-surgically are high-fat foods, high-sugar beverages, snacks and desserts, caffeine, carbonated drinks, and alcohol. You're probably wondering what foods are left, but I assure you there are many foods that are tasty and enjoyable, and we will help you with this. Dietitians are here to help you become as successful as possible.
Spring Bakke from Altru's Medical Fitness Center will now explain the importance of exercise in your weight loss journey.
Hi, my name is Spring Bakke. I'm one of the medical fitness specialists that works with the bariatric program. I'm here to tell you how exercise fits into your weight loss journey. Exercise is an essential tool for maintaining a healthy weight long term. Exercise can help make you feel better by increasing your endurance, muscular strength, flexibility, and your ability to perform activities of your daily life. As a patient in Altru's bariatric program, prior to surgery, you will complete an exercise assessment to determine which exercises are right for you. After your surgery, you will participate in Altru's New Start program. This 6-week program provides exercise education, tips for setting goals, strategies for overcoming barriers, and support for your personal success. Our focus is to help you achieve a healthy weight and to maintain it for a lifetime.
Along with a healthy body, you need a healthy mind. Chris Workley from Altru's Behavioral Health will now explain the importance of social work through your journey.
Hello, my name is Chris Workley, and I'm one of the 4 clinical social workers who work with Altru's Bariatric Center. We perform the initial psychosocial assessments and work with the behavior change group. First, let's talk about the psychosocial assessments. Prior to your surgery, we go over psychological, emotional, and social aspects of your life. We'll ask about your psychosocial history, including any past psychiatric treatment. We'll explore your readiness for lifestyle changes. And we'll ask you about the people in your life who will provide you support as you make this weight loss journey. Following your surgery, you will participate in weekly group sessions focusing on how, when, and why we eat. We'll concentrate on mindful eating versus mindless eating, readiness for change, perceptions, attitudes, and beliefs about food, and how to make changes in your eating behavior. These group sessions are offered in Grand Forks, Devils Lake, and Roseau. Thank you very much.
Next, Dr. Robin Hape will walk you through your surgical options, including the lap band, the Roux-en-Y gastric bypass, and the sleeve gastrectomy.
I'm Dr. Robin Hape, one of 2 general surgeons here at the Altru Health System that performs the lap band procedure. The lap band is a device that fits snugly across the upper portion of the stomach. The lap band restricts how much food you can eat. The lap band is only successful when combined with dieting, exercise, and behavior change. With the lap band, you can expect to lose up to 60% of your excess body weight. Possible complications with the lap band include band slippage. This is where the band slips to the lower portion of the stomach. It occurs between 3 and 5% of the time, and when it occurs, it requires additional surgery. Other very rare complications of the band include erosions, where the band would put a hole in the stomach, leakage, or flippage of the port. These may also require surgery. Other forms of bariatric surgery include the Roux-en-Y gastric bypass and the gastric sleeve. The gastric bypass is an irreversible change to your anatomy. The stomach is stapled away, leaving a small pouch, and much of the small intestine is bypassed, creating a malabsorptive state. The gastric sleeve results in removal of much of your stomach, leaving a small, tiny tube. It is restrictive, much like the lap band. Although the weight loss from the gastric bypass can be somewhat faster than the band, the risks are much more significant. Where the stomach and the small intestine are hooked back together, there is a risk of leaks. When leaks occur in this area, a patient can become septic and even die. The death rate from this procedure is about 1 in 200. The leak rate is quite low, however, in the range of 1 to 3%. Other risks with the gastric bypass include malabsorption, bowel obstructions, hernias, and dumping syndrome, which is profuse diarrhea, which can occur after this surgery. The risks from the gastric sleeve are more significant than they are for the band, but the procedure is much safer than the gastric bypass. The only real consideration with the gastric sleeve are leaks from the staple line, and again, that leak rate is between 1 and 3%. You and your surgeon will discuss which type of bariatric surgery is best for you.
Continued care after your surgery is vital to achieving your weight loss goals. Shelley Wright is here to talk about surgical aftercare.
I'm Shelley Wright, and I'm a physician's assistant at the Altru Bariatric Center. I take care of patients after bariatric surgery. Following laparoscopic bariatric surgery, our patients are restricted from lifting anything more than 10 pounds for 4 to 6 weeks. Following laparoscopic Roux-en-Y gastric bypass or laparoscopic sleeve gastrectomy, our patients are in the hospital for 2 to 5 days. They are usually ready to go back to work within 2 to 3 weeks. Following laparoscopic band surgery, our patients are in the hospital overnight. They are usually ready to go back to work within 1 to 2 weeks. Aftercare following bariatric surgery is important for success. It's also important so that we can identify any possible complications following surgery. After Roux-en-Y gastric bypass, the patients are seen in the clinic 1 week after surgery. You will then be seen in the clinic 1, 2, 3, 6, 9, 12, and 18 months after surgery. You then will also need to be seen annually after that. Periodically, blood work will be done to make sure you do not have any nutritional deficiencies or any other complications from surgery. Following lap band surgery, patients will be seen in the clinic 1 week after surgery. The first adjustment or tightening of the band will be done 4 to 6 weeks after surgery.
Subsequent adjustments to the band can be done as frequently as every 2 to 4 weeks as needed. For the first year after surgery, patients may need anywhere from 4 to 8 adjustments to their band. Following bariatric surgery, success depends on you. It is important to remember that surgery is only a tool. The Altru Bariatric Center has multiple support services to help you on a successful weight loss journey.
That's a brief overview of Altru's bariatric program. If you're interested in getting started, please fill out your health history form and return it to us. If you have more questions after reviewing the material in the packet, please contact Altru's Bariatric Center at 701-780-6729 or 1-800-437-5373, extension 6729. Again, thank you for your interest. And now I'd like to invite you to watch a few patient testimonials.
And I was losing weight, but I still didn't have control over my eating. And now I do. What brought me to Altru was initially I was thinking about having the lap band surgery here, and I had heard about Dr. McCall. My insurance company, when I was on the phone with them discussing if I'd be covered, they had told me that Altru did do lap band surgery, and they had said that Dr. McCall was the doctor that met the requirements for my insurance to cover it, and it was kind of neat to hear them say that they'd actually heard of Dr. McCall and that he was, you know, one of the best lap band surgeons. So it was really neat to hear that from my insurance provider, and so initially that's why. And as I continued to research, I found that Altru offered the New Start program and also the behavioral classes that I took, and so I knew going in that I needed to do more than just have a surgery. You know, it's a lifestyle change. You know, overeating isn't a matter of just putting food in your mouth. It's a mental thing. There's so much more to it. And so for me to come here and to discover and learn that the classes were being offered I was just, at first, I gotta be honest, at first I was like, I have to do what? I have to do how many weeks of classes? And I have to do all this, because I was very anxious to have the surgery. And so really once the classes started, my thought process really changed. The whole group, whatever you want to call the lap band little community of Altru workers, they just all have been very supportive and want to know how we're doing too. You know, they want to know, and it's nice that we do have to come back and check in, because that way, you know, you feel that it matters, that we matter, and where we're at matters, and really caring is a great word, because I feel that Altru cares about me and my success with my surgery, and that really truly means a lot to me. And I'm not afraid either. There's any fear that you have, they have the answers for you. They have the classes, the information classes, whatever they you know, just help take away that fear. So.
I had Roux-en-Y gastric bypass surgery 49 months ago now. It was 4 years ago in March. Right before I was 50, I was in as bad a health as one could imagine. I had already had a cardiac stent put in, angioplasty put in. I was probably coming to the clinic 2-3 times a month. I was on 18 different medications. Couldn't walk up a flight of steps without being out of breath. Very, 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 very limited. At one point in time I was pushing, I wasn't far away from 400 pounds, about 377 pounds. And I knew I had to do something. I knew I had to do something. I was averaging, I'd say, about 30 clinic visits a year before, and I think last year I was here 3 times. 30 visits here a year was costing me $600, and so that went from 600 down to 60, and I went from 18 medications to 3. So just between medication and co-pays, it's an unbelievable amount of savings. But when you get into food, you get into clothing, and all of those things, it's got to be an amazing amount of money. Every dime of which my grandkids have benefited from. I think I had a team of probably 5 doctors here that I saw on a regular basis. They were all real supportive, all real supportive. That's probably the thing that stands out the most is it's an entire atmosphere of feeling supportive, feeling supported. You never get the feeling, or I never got the feeling that, okay, now you had the surgery and, you know, now you're a post-surgical patient, so we're kind of done with you. It's just been kind of an ongoing relationship. You know, I don't know how many different ways there is to say life-altering, but it certainly has been. I suppose any place you go has pluses and minuses, but I got to tell you, I can't think of any minuses. I really can't. The experience has been wonderful. I went from not being able to walk up and down a basketball court to the last 2.5 years I've been refereeing basketball games. The reason I would recommend it is the same reason why I know that people use it, is the comprehensive nature of it. Making people, you know, have the psychosocial evaluation, making sure that you have, you know, tried other weight loss kinds of things. I think it just maximizes the opportunity for success. Hard for me to imagine why anyone would go from unhealthy to healthy and then let that slip away again. Yeah, I sit here today, I'm already 4 years older than my mother was when she died. And I don't have any plans on checking out any too soon.